In hospice and dementia care, providing comfort and preserving dignity are paramount. Alternative treatments like cannabis and CBD are giving patients hope and improving their quality of life, thanks in part to the guidance the Cannability consulting experts are able to provide medical professionals.
My name is Kelly Frank, and I'm a registered nurse case manager with hospice, and we often collaborate with them to help provide comfort and maintain dignity at end of life. Sometimes your typical medications just are not as effective. Especially with those patients with persistent nausea, CBD was effective for them. It allows those patients to have a better quality of life.
We're able to address multiple different things that are antipsychotics and all of these medications just really create more harm for these residents. And the beauty of it really is the fact that these residents' lives change. You can see them going from these anxious balls into somebody that's actually able to enjoy those little specks of life that they are able to enjoy still. And so we've just kind of seen that grow and grow, and we've become big proponents with it.
In about 2022, we started looking at some alternative treatments for our dementia patients. With CBD, we're able to manage some of the behaviors that you sometimes see with dementia without having to use those traditional antipsychotics.
With end-of-life care, when there's so many comorbidities and unmanaged symptoms, this really helps to improve their quality of life. They're calmer, they're not as restless, they're not as anxious or agitated.
A lot of times when we start a patient on CBD, we just start seeing this improvement overall where they're sleeping better, they're eating better, they just are disappearing to be much more content and not having the outburst and the behaviors that they were having, less aggression, less anxiety, and that's what we want.
It's changed so many people, and to see that happen right before you is something that's really a gift.
They know with the narcotics, you have the constipation or you have the loopiness. A lot of people are worried about being overly sedated and not being able to enjoy their loved ones and their quality of life. So when they try this, they're getting some of that power back. They feel empowered. They can enjoy that time with their loved ones, and it improves their quality of life.
We're able to deprescribe, get them off of scheduled pain meds, get them off opioids. Especially with elder population, we don't want them on opioids. We don't want them on these psychoactive drugs. We want to try to minimize their medication list, so we've been able to deprescribe by having them go on CBD.
Through collaboration with medical teams, Cannability consulting experts are able to provide cannabis and CBD as new options for symptom relief, giving patients a better quality of life.
It's been amazing because it's another resource. I think it's very exciting, the direction we're going in. I look forward to seeing how this can benefit patients, families, and yeah.